Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, clinical features of subarachnoid hemorrhage. So, in the subarachnoid hemorrhage, the patient with subarachnoid hemorrhage presents with sudden severe onset of headache. And this sudden severe headache is present in the absence of focal neurological deficit. And there is also transient loss of consciousness is also seen in the patient with neck rigidity. There is also conscious loss of consciousness is seen with neck rigidity, and this neck rigidity will actually mimic meningitis. Okay, the patient will also have neck stiffness with vomiting are the associated features, and focal neurological deficit. Has already said these focal neurological deficit in a patient with subarachnoid hemorrhage, they are actually uncommon. And this subarachnoid hemorrhage is also it is also associated with prodromal symptoms. It is also associated with prodromal symptoms like the third cranial nerve palsy. If you see, whenever there is cranial nerve palsy is associated with subarachnoid hemorrhage. This third cranial nerve palsy occurs whenever there is aneurysm. Whenever there is aneurysm at the junction of posterior cerebral artery and internal carotid artery, this posterior cerebral artery aneurysm will compress the third nerve, causing third nerve palsy. It might also be associated with sixth nerve palsy also. This sixth nerve palsy occurs if there is an aneurysm in the cavernous sinus. Aneurysm in the cavernous sinus, at the center of the cavernous sinus we have sixth nerve, so this will result in sixth nerve palsy. Sometimes occipital and posterior cervical pain is also seen. In occipital and posterior cervical pain is seen, and this occipital and posterior cervical nerve pain occurs whenever there is inferior cerebellar artery aneurysm. Either the whenever there is inferior cerebellar artery aneurysm, either the anterior part or the posterior part, this is responsible for occipital and posterior cervical pain. Even sometimes pain can be seen behind the eye. This pain behind the eye is mainly because of the middle cerebral artery aneurysm will cause pain behind the eye. So these are the prodromal symptoms which are seen. And sometimes the aneurysms may also undergo these aneurysms which we are talking about. These aneurysms may also result in small ruptures, or they can result in small leaks, and these small ruptures or small leaks which are seen in aneurysms are called as sentinel bleeds. Then, out of all these aneurysms, the most common site of berry aneurysm, if it was asked, the most common site of berry aneurysm is actually the junction of anterior cerebral artery and the anterior communicating artery is the most common site of berry aneurysm. And then if we see, the vertebral artery is the least common site of berry aneurysm is the vertebral artery. Then if you were asked what is the most common nerve involved in the berry aneurysm, the most common nerve involved in the berry aneurysm is the third nerve.
thank you and thank you for watching.